The vaccines have arrived, but millions of African Americans say they won't be taking them.
Myself, I would rather sit back and watch and see what kind of long-term side effects other people have, not me.
I won't be taking it, only because I know, as a person who have participated in medical trials before, it should have gone through a longer process.
Mistrust is particularly high in communities of colour after historical medical abuses of black people by federal health officials.
I'm going to probably wait about 9 months and see how it's affecting others, because in many trials in the United States, going back to the 1800s, they would test on African Americans and see how that went, and many African Americans died.
The director of Washington, D.C.'s Department of Health, Dr. LaQuandra Nesbitt, acknowledges the challenge is huge.
When we surveyed our population here in the District of Columbia, we saw that rates for acceptance of the COVID-19 vaccine was as high as 90% in some populations and was as low as 60% amongst Blacks or African Americans. And what was of other concern was even when we looked at healthcare workers and essential workers who were Black or African American, the acceptance of the COVID-19 vaccine still did not move above 60%.
Organisations like the Black Coalition Against COVID are trying to change that. They hold regular town halls so the community can hear directly from Black doctors, nurses and scientists.
And we've just heard that you were critical to your NIH Institute's coronavirus effort. You are the perfect person to help many in our audience.
Thank you all for inviting me here.
The President's Chief Medical Advisor, Dr. Anthony Fauci, also takes part to explain why it's so vital for Black Americans to get vaccinated.
African Americans continue to bear a disproportionate burden, both of the infections compared to the demographic distribution in society, as well as for the severity of infections based on hospitalizations per 100,000, as well as deaths per 100,000 related to COVID.
Community leaders like Reverend Calvin Butts of the nationally renowned Abyssinian Baptist Church in New York City says often the messenger is as important as the message.
We can get the information out. We can be the mouthpiece. We can be the advocates. And people trust us. But I can say that based on the scientists I know, you should take advantage of getting it. Our churches, if possible, should become vaccination centers, and our ministers should demonstrate our belief in our scientists, doctors, nurses, and say we will be among the first to take the vaccine.
There's no time to waste. President Biden says that up to 660,000 Americans could die before the pandemic is brought under control. There's no doubt that this administration needs to increase vaccine production, but it also needs to ensure that all Americans are willing to be immunized. Kate Fisher, SABC News, Washington.